So the role of study manager is to make sure that we have all the essential documents in place before the study starts, make sure that the setup has been done, so any supplies, equipment, any processes such as our green light sign off is actually done. So that kicks off the start of the study. Once the study is ongoing in the clinic, the study manager makes sure that it's all running smoothly. If there are any incidents or any issues, then we have to get that resolved. Make sure that they meet with the external monitors who represent the sponsors, or sometimes other sponsors, to make sure that all the data that is being collected is being checked and monitored, and any queries that are resolved. And once the study is finished in the clinic, we have to make sure that all the post-clinical processes are done. So we notify the MHRA, the ethics. We also archive all the study documents in the master study file, which is ongoing anyway, but we make sure that's completed at the end of the study, sent to the sponsor, and all the CRFs are signed off. The minimum requirements we look for will be a life science degree and some experience in the clinic, either here at Richmond or elsewhere. We tend to want people who are quite hardworking, because it is hard work, quite adaptable and who learn quickly, and generally people who like managing people, managing teams, who write well, because there is quite a lot of writing involved, and just being a good team player and show potential for management. Within study management departments, there are 4 levels. So when you start within your probation period, you're called a study manager associate, and 3 to 6 months thereafter, if you're able to do the tasks on that level, then you will become a study manager. So then you're able to manage your own study. Once you've been a study manager for about a year, you can progress to become a senior study manager. Again, we have a checklist to make sure that you've achieved all the tasks at that level, and then a clinical project manager thereafter. Okay, the graduate rotation is really a feeder system into study management. So once a graduate has been working in the clinic for a while, they would go into the various departments within Richmond. So they could go into the lab, to VR, to clinical compliance, to data management, and to scheduling for a few months. And then they learn the basic tasks within those departments under the departmental manager. But they also work very closely with the study manager to start to learn the study management related roles within that department, so that in the lab, for example, they may get involved in compiling the tube labeling checklist. Within data management, they would QC the CRF for the study. Within clinical compliance, they start to, as well as QCing the study data, they will get involved in meeting with the external monitors. So it's a way of introducing and gaining experience within that department for the related roles that they would do within study management. If and when they do become a study manager associate, they already have these basic skill sets that we look for to develop further. In terms of training, so there's a foundation training which would be with myself. We go through a series of sections within the study management SOP, all the sections, but through a PowerPoint presentation, and it's also quite interactive, and we look at some real life documents or processes, and it's a chance to introduce that particular aspect of study management, and also a chance for the graduates to ask questions and to learn from, maybe look at issues that we have within, or challenges I should say, within that particular section. The main training is actually on the job. So whilst they're at the entry level, they will work very closely with a study manager or a senior study manager, and they will actually do the things that a study manager does. So in the first instance, we will train you how to do that thing, then they get a chance to do it themselves, we check it, give you feedback, and then the next time we give you that document or process, we expect to see an improvement, and we do maybe three times to make sure that you're competent. We can actually tick you off as being competent in that particular aspect. It's very busy. It's a very busy department. There's always something going on, something that needs doing. Each study manager will tend to have maybe 4 or 5 studies ongoing at any particular time at various levels. It's busiest at the study setup stage, so we try not to overlap more than one study at a time. But basically, they're compiling documents, they're bringing the teams together, they're making sure all the departments are aware that the study's coming out, any training that is needed, any specialist equipment. They're interacting quite a lot with almost all the departments, so the clinic, the lab, the VR, scheduling. They're also reporting to the PIs and working very closely with the project manager to make sure the study is set up properly and runs well and finishes to the expected quality and timeline. I've been at Richmond for 8 years now, just over. My commitment is that I like the role. I've mentioned just now how busy it is, but I actually like that dynamic. Every day is a bit different, every study is a bit different, so I never get bored. There's always lots to do. One of the big advantages of being in study management is you learn a lot quite quickly. It's a steep learning curve and you keep learning new things, because no 2 studies are the same and even no 2 days are the same. So I get a sense of satisfaction at the end of the day knowing that I've been in a challenging environment, but we've been able to overcome the challenges, and then hopefully we're helping to bring new drugs to the market, to the patients who need them.